Hi everyone, this is my pig. This is the head. These are the 4 appendages. This is the trunk of the body. And here is the tail, where the anus is. On each of the 4 appendages, you can see that there are hooves. And when we start looking at the trunk of the body, we can see this is the umbilical cord. And here along either side are the mammillary papillae. Also, my pig, the urogenital opening is up here, right below, posterior to the umbilical cord is the urogenital opening, which tells me that my pig is a boy, a male. And then this means that this would be the scrotum of my pig. Looking at the anterior side again of the pig, I've made some incisions on either sides of the jaw. And I can start to see this is the tongue, and looking closer at the tongue, we can start to see the papillae. Also, I can see here that underneath the tongue of my pig, there are some baby teeth. I see 2 baby teeth here on the bottom. Those would be the canines. And there are also 4 baby teeth on the top. When we look at the top of the pig's jaw, we can see very close to the baby teeth on the outer part, we can see the hard palate, which has lots of ridges and does feel very hard. And then as we start going closer to the opening of the mouth, where the pig's throat would be, we can see it starts to get spongy, and this would be called the soft palate. So this is the hard palate and this is the soft palate. Also near the soft palate, we can see if I just open the pig's jaw a little more, we can see this is the epiglottis, and it feels soft and squishy. And then we can see here there is a hole, and this would be the glottis. If I put the probe in here, this would be the glottis. Now I'm going to take my scalpel and I'm going to begin the dissection. I'm going from the chest to the chin. And then I'm going to follow this opening down. going to start cutting around. Here. Start with the liquid. Continue on the other side. Now, I'm going to use forceps to lift, and I'm going to continue cutting the tissue around the umbilical cord. And try to see if I can peel it back. Once I peel back, the areas where I've cut, you can see that once I lift the abdominal cavity, I put my probe here, you can see this is the continuation of the umbilical vein. You can see the umbilical cords here, and here on the underside would be the umbilical vein. We can also begin to see parts of the liver. Again, to make sure that I can have access to the diaphragm. Cutting the tissue. So we can see here this fatty tissue that is above or anterior to the liver would be the diaphragm of the pig. So that would be located right around here. Would be the diaphragm of the pig. If this is the liver, the diaphragm would be right here. So this is the dissection of the abdominal cavity of the pig. Thanks for watching.